Some people have a brain condition where the back of the brain, this area here called the cerebellum, can actually squeeze through the base of the skull over here called the foramen magnum. This condition is called a Chiari. This condition can create a lot of compression along the area of the brainstem, which can create things like headaches, numbness, tingling, weakness, trouble with balance, and even trouble with swallowing. The way to treat this surgically is by placing a patient in a Mayfield skull clamp to prepare them for surgery. Once the patient's head is fixated to the bed, we can then make an incision at the base of the skull down the midline of the neck. And the idea is that we remove the base portion of the skull to make a bigger opening for that bulging component of the brain to be able to fit. We just make that opening at the base of the skull a little bit larger so that the brain tissue is not so compressed. And in some situations, we need to perform what's called a laminectomy of C1, where we remove the back arch of the first cervical vertebra. To further decompress the brain, we have to make an incision in the outer protective layer of the brain called the dura. We then repair the dura with a dural substitute, where the opening is then covered with a graft that is sutured into the original dura, making sure we create a watertight closure.